Hello, I'm Laura Cassidy from the American Chemical Society. Welcome to this media briefing from ACS Spring 2022. The colon might be the last place you'd consider getting a tattoo, but endoscopic tattooing is an important medical technique for marking colorectal lesions for surgery or follow-up. Today, scientists report a next-generation ink used for these markings that diffuses less and is more biocompatible than existing inks. The new formulation could make it easier to identify and remove complex colonic polyps and tumors, the researchers say. We're joined today by Dr. Kaushal Rege and Subhadeep Dutta from Arizona State University, as well as Dr. Rahul Panala from Mayo Clinic, Arizona. Thank you for joining us. So what is a colon tattoo and why would a person need one?
So when we do, as gastroenterologists, we do colonoscopies for detection of colon cancer and for screening for colon cancer to detect polyps. So there are several instances where we may need to put an ink or a tattoo to identify a lesion. It could be a large polyp that requires a much more complex procedure down the road. It could be a polyp that we remove, but we want to come back and look at that area in the future. Or we are marking something that the surgeon, when they go in to remove that piece of the colon, knows exactly which area the polyp is located. So those are some of the most common reasons that we place ink or a tattoo in the colon.
Dr. Panala, I understand there are already some colon tattoo inks on the market. What inspired you to develop a new ink?
Yeah, so there has been a tattoo ink on the market for many years. Some of the most important disadvantages that we see and what prompted our interest in this area is the fact that the current preparations really haven't changed in many years, and they induce a fair amount of scarring when we put it. So as you can imagine, if there's a significant degree of scarring, it makes it much harder for us to do our subsequent procedure. And the fact that the current preparations really, if you think about a tattoo, it has to be precise, it has to be localized. So unfortunately, what happens with the current preparations is that they tend to diffuse over time, so that when we do tend to go back, we see a very broad-based, very diffuse tattoo, which can impair our localization of these lesions.
Subhadeep, how did you go about developing the new ink?
So when we got to know about this problem from Dr. Panala, me and my advisor, Professor Rege, we brainstormed different aspects. Since we are a bioengineering lab, we started thinking about well-established chemistry. So we formulated our materials in a way that we have a metal-derived nanoparticles, which essentially is giving the contrast. And on the other hand, it has a protective coating of mucoadhesive polymer, which is helping to retain the spot in place.
How did you test the new colon tattoo ink?
So when we generated a library of this colon tattoo formulation, we actually measured its inflammation response with a in vitro assay. And then after that, we tested its ex vivo response with respect to its contrast and spot retention ability with porcine intestine tissues. After that, we proceeded with our preclinical studies with a subcutaneous mice model where we injected the ink in the subcutaneous space and observed its effect over a 30-day period to see its spot retention capability, any kind of acute inflammation response, and its contrast.
And so far, does it look better than existing inks?
Yes, so far in comparison to existing links, our preclinical studies shows that the spot size is approximately 4 to 5 times smaller than the commercially available inks, which has been used clinically. And also it has minimal inflammation in our experiments in mice.
Dr. Rege, why doesn't the new ink diffuse as much as existing inks?
The new ink does not diffuse as much as existing inks because we have formulated different chemistries of mucoadhesive polymers into this formulation. As a result of which, this, especially when we do these experiments, both ex vivo in the porcine intestines, as well as in vivo in live mice, they are essentially encapsulated at the spot because of their adhesion to tissue, and they do not extravasate out of that spot.
Are there any signs that the ink causes inflammation?
When we did our preclinical studies in mice, after we analyzed the histopathology, we found a few of our candidates showed a little bit of inflammation, but we also have some lead candidates which has very low or minimal level of inflammation.
Dr. Rege, I understand that you have different versions or formulations of the ink. Has anyone emerged as a clear winner?
Yes, we have designed this research to essentially quickly test a different number of formulations with different chemistries in mind, considering potential mucoadhesivity, potential minimal inflammation, as well as a long-term contrast. So based on our studies that are both in vitro, ex vivo, as well as in vivo in mice, we have a few candidates that have emerged that minimize inflammation, retain the spot, as well as offer contrast. And in addition, have the potential for multimodal imaging that can be used in the future.
Dr. Pannala, what are your next steps for this research?
So we really have to then build on this excellent lab work that has been done and sort of go to the next step to try to test this. The closest way we can replicate what we do clinically is to do endoscopic experiments in a porcine or live pig model. So with all the necessary precautions, we do endoscopy. We're going to inject all the test candidates and assess the contrast, assess the diffusion, come back and look at it at a follow-up endoscopy a few weeks later to see how these candidate markers behave and assess them like exactly how we would do in the human colon. And that would really give us a sense of the performance of these candidate inks.
And how do you think a better colon tattoo ink could improve patient care?
So there's several ways. I think it goes back to the disadvantages of the current ink. I think one is diffusion. If you're able to precisely locate and retain the ink at that point, then it makes subsequent procedures easier. That's number one. Number two, obviously, we want to have minimal inflammation and minimal scarring for obvious reasons. And then number three, if you're able to detect this ink on imaging, whether it be by CT scan or MRI or other modalities, then it really changes it's a game changer because we can then pinpoint these lesions in a non-invasive manner.
Do you think the ink could be used for other medical procedures in addition to colon tattoos?
Yeah, I think, if the ink behaves in how we expect it to, and we're able to do this precisely, it really opens up a lot of other avenues and opportunities. A simple example would be marking small pancreatic tumors, because these are really hard to find on surgery. There's several other potential opportunities. So this can be broadly applicable.
Thank you, Dr. Rege, Dr. Pannala, and Subhadeep for sharing your research with us.
Thank you.
Thank you.
Thank you.
Be sure to check out our other media briefings for ACS Spring 2022, which will be posted throughout the meeting at acs.org/ACS Spring 2022 briefing.